English medicine. The speaker today is an expert. He spent time in Harvard University, did epidemiology, so you know these things and help us out. And you know, Dr. Raman has been in epidemiology, and over the next several months, he'll keep on telling what sort of evidence what we are talking about. So without further ado, I'd like to introduce today's speaker. Dr. Hirama, we all know, he spoke to us before. He's a member of the faculty at the university. Assistant professor, as is mentioned here. And it's an extra privilege to welcome Jan. She came here last time we had spoke on hypertension. Jan works in the department as well, same. So I'll pass it on to you, Sapna.
Thank you. Thanks again for that generous introduction. My name is Swapnil Hiramat. I'm a nephrologist. I'm a kidney doctor and a hypertension specialist. I also am part of the Hypertension Canada task force, which looks at guidelines, which looks at what should the blood pressure target be. But I'm speaking here in my personal capacity, not necessarily representing Hypertension Canada. Can we? Sorry. And we'll try to talk a little bit about why are we working.
Point here. What's going on? Power is not on.
Okay, thank you. So just the objectives which Dr. Jinder had already introduced about what is blood pressure, why does it matter, how do we measure it, which I'll hand over to Jan in the middle, and what can be done to treat high blood pressure. So if you see, if you look at what is really blood pressure, that's your heart that's beating roughly 60 to 80 to 100 times a minute. And blood pressure represents the power with which your heart is, roughly speaking, is actually contracting. So as the heart is contracting, all the blood flows through the arteries which supply your tissues. And there is the systolic peak that you see is because of that heart which is pumping so many times a minute. And if you see, over time, most of us are going to develop high blood pressure. This is a slide which shows what is the risk of developing high blood pressure after the age of 65 among patients who don't have high blood pressure at the age of 65. And this is looking at women as well as men. And with time, you see that almost all of us, if we live long enough, are going to develop high blood pressure. Another way to look at it is, so there is the systolic blood pressure and the diastolic blood pressure, and Jan will come to that in a little bit more detail. So there are two numbers whenever anyone checks blood pressure. There is the upper number and a lower number. So and those behave differently because of the way your body deals with changing arteries, and the arteries how they thicken and harden. So with age, the systolic blood pressure keeps going up. But the diastolic pressure is different. So it does go up, and when you're roughly 40 to 50, it is at the peak. But as you age further, it actually goes down. So if you're 60 years of age or older, it's usually systolic hypertension that you will have. So it's your upper number which will keep going up. But you may notice that your lower number is actually low, and it may be lower, than the 80 limit. So it may be only the higher number which is abnormal, and the lower number which may be normal. And that is the most common kind of high blood pressure that we see as we age. And what causes high blood pressure? So most individuals unfortunately have what we call is essential hypertension. Now essential is not really essential, it's an unfortunate terminology. What it means is that we don't have a cause for it. There is no specific reason why the blood pressure is happening. It's more of a biology, it's more of wear and tear, it's how your body is aging, which causes the high blood pressure. In rare cases, we do see that there is a fixable cause. So a few months ago, Dr. Chandy had spoken about sleep apnea. So if sleep apnea can cause high blood pressure, and if it is treated, then the blood pressure can come down. There are certain other hormonal disorders which can cause high blood pressure, and if we find those, we fix them, we treat them, the blood pressure is cured. But these are very rare. They are uncommon, and in most cases we will see that it is just a part of aging, and there is no specific cause for that, which is why it's called essential hypertension. One of the big things, of course, is family history. So if people in your family, if your parents have high blood pressure, it's very likely that you will end up having high blood pressure as well. So, you can always blame your parents. And why does it matter? So if you look at this chart shows what is the cause of, when you look at contributing factors to mortality, to death, what are the big factors? And people often think about cancer and high cholesterol and stuff like that, but hypertension is the leading cause of death, risk of death in North America. I'm not talking about diseases, I'm talking about risk factors that lead to diseases which cause death, and hypertension is the number one when it comes to risk factors which are causing mortality, which is why it's important to talk about high blood pressure. So why is it so? Why does high blood pressure, it's just a number, right? Your doctor may be measuring it on your annual physical. You feel fine. So why should we be bothered about high blood pressure? And this is why, is that high blood pressure, it is very tightly linked to hardening of the arteries, the atherosclerosis, which is the other term you may have heard. But all these cause a bunch of things. So they increase the risk of stroke. In fact, stroke and high blood pressure are very tightly linked. It's the single most important risk factor for causing stroke. I deal with patients with kidney failure, and high blood pressure is a huge contributing factor for kidney failure. And thirdly, heart failure and heart attacks, which are mainly because of atherosclerosis. So three big organs, your brain, your kidney, and your heart are dependent on having a normal blood pressure. There are many other things that can go wrong, right? With high blood pressure, you can also have blockages in your arteries in your leg. You can have problems with your vision, but these are the big three that I'm mentioning now. And let's, since most of us are in some ways or the other from India, this is some interesting data I found about the risk of high blood pressure among people in India. This is what is called as, it's a meta-analysis, so you don't look at one study, it's multiple studies which are pooled together. So they looked at all the studies done in India among Indian people to see what is the risk of hypertension, what is the prevalence of hypertension in the population level. And what they found is that the overall risk is somewhere around 30% among all people who to have high blood pressure, but there is a lot of variation. If you look at North Indian rural, so there were 6 studies from rural places in North India, and the risk seems to be about 15%, whereas in South India it's more around close to 30%. And similarly, there seems to be a risk of about 27% in the rural, but a slightly higher 29% in the, 33% in the urban, which is what we expect, right? The lifestyle is different when you are in the rural areas compared to the urban areas, and that is perhaps contributing to this higher blood pressure in the urban. But it's not that urban areas are necessarily better, because when we look at awareness, most people in the rural areas are not really aware. So only 25% of the people knew that they had high blood pressure. 73% did not know, who had high blood pressure did not know they had high blood pressure, which is way lower than in urban areas where about 40% were aware that they had high blood pressure. Similarly, if you look at the treatment, rural areas fare much worse. So most of them were not aware, most of them were not on treatment, and a much higher number where only 10% were really controlled. So there are pros and cons of living in urban versus rural areas, but this is pretty shocking data in some respects, and something we know that it's a problem that is not known. It is something that is not well controlled or well treated. And this is from looking at South Asians in India. South Asians are at a much higher risk of cardiovascular disease. Maybe it's the genes, maybe it's because we have smaller arteries. There are many theories. It's the food we eat. But high blood pressure also ranks as one of the factors. So if you see our risk of prevalence of high blood pressure is higher than if you look at people of European origin. And of course, other Asian ethnic origin is also just as bad. So this is why hypertension is known as a silent killer. So I have set the base to say that why high blood pressure is bad. And with this, I would like to invite Jan to talk about how do we measure blood pressure. And then we'll switch back to how do we treat blood pressure at the end. Jan is a specialist nurse in hypertension at the special hypertension clinic at the Riverside Hospital. In fact, next month we are having a special conference to family doctors to talk about how high blood pressure should be treated and how it should be managed. And Jan will be teaching family doctors how to measure blood pressure properly, because she does that a lot. And in fact, even in our clinic, they don't trust the doctors to measure blood pressure. We only allow nurses to check blood pressure. So without much ado, I'll ask Jan to talk about how to measure blood pressure.
To talk to you a little bit about blood pressure measurement. It's a pleasure for me to be here. Dr. Jindal and Dr. Hiremath will tell you I can talk a long time about blood pressure measurement. Something I'm very passionate about. I learned how to measure blood pressure about 35 years ago. I know you probably find that shocking. I don't even look 35, I know. But anyways, I've been a nurse for over 30 years, and I can tell you honestly, before I started in the hypertension clinic about 12 years ago, I took a whole lot of blood pressures and didn't really understand the importance and the significance on how I measured that blood pressure, and that treatment decisions for folks like you were being made on those numbers. And I wasn't really doing it properly, and it's hard for me to admit that because I'm supposed to be helping, not harming. But we've learned a lot about the importance of blood pressure measurement. So I'll just talk briefly, we're overlapping a little bit. But what is blood pressure? So it's that maximum force of your heart beating against every blood vessel wall in your entire body. So Dr. Hiremath talked about stroke. We think about our brain, heart failure, but it also affects the tiny vessels in your eyes, your kidneys, of course, causes all kinds of problems. So when you think about that, you think about keeping your blood pressure well controlled has a marked impact on your entire system, your health system. And the one thing I really want you to take from what I say today is to remember that blood pressure is not a constant. It's constantly changing. So when you're at home with your home blood pressure monitor or at the pharmacy and you're sitting there pressing the button, you constantly see a different number. And that's because your blood pressure is a variable. How many people have home blood pressure monitors or have ever stuck their arm in one of those ones at the pharmacy? So many of you. So you have to remember that when you're taking that pressure, that many things affect the number that you're seeing there. So proper blood pressure measurement is the cornerstone of all of our treatment decisions, and it's the foundation for clinical decisions that are made to keep us well. So Dr. Hiremath touched on this. It's important that you know your numbers. So write them down, keep a little journal, whether they were taken at the pharmacy, whether you just walked in and stuck your arm in the machine, or whether you sat and rested quietly and did duplicate measurements. So the systolic is the top number, that's that maximum force of your heart, and the diastolic is the lower number when the heart is relaxing. So this is my best friend in the hypertension clinic. It's a mercury sphygmomanometer. The fortunate thing is it works on everybody, and whether you're having an irregular heartbeat or whether your heart is very slow, this works on everybody. But with the concerns around mercury in Canada, they're phasing this out, so you're not going to see this very much anymore. And we're moving to these automated devices, the same technology that you use at home. And I brought one here today if anybody wants to try it out. But the thing with this is you have to make sure whatever device we're using is appropriate for you and works on you. And the benefit of these is the nurse is in the room for that first reading, and it's not unusual for me to see a number like that with the nurse in the room. But then we go out of the room and it takes a series of 5 more readings while you're alone resting quietly in the room. And this is the difference between what we call a casual blood pressure, so that's just with the cuff put on your arm, we take 1 reading, and a resting blood pressure. And that number can be very variable. I can leave the room, not because I'm particularly scary, but just that white coat component. And go back in the room and the blood pressure is 140 or 130, okay? So that's the variability of blood pressure. So the key things for me as a nurse, and also for you, and we'll repeat this a couple of times, is how you're positioned. Just crossing your legs raises your blood pressure. You can change your blood pressure by 10 to 15 millimeters of mercury, just depending on where your arm is. So it's really important when you go to your doctor and they're using these automated devices that they do it properly. And this is how we do it. The patient is seated, back supported in a chair, arms supported so the middle of the cuff is at the level of your heart, feet flat on the floor. Again, the arms supported so that middle of the cuff is at the level of your heart. And then we take a first reading, make sure it's working, and then leave you alone in the room. The other thing, other than that resting period, is that you use the right size cuff for your arm. It's a really easy measurement to take, and I'll just show you. This is an adult small, and this is an adult extra large. You can see the difference. If I use a cuff on you that's too small, it actually makes your blood pressure register higher than it actually is. And if I use a cuff that's too large, it makes your blood pressure register lower than it actually is. So cuff sizing is very important, and there's all kinds of different ways that you can see on the cuff that you have at home to make sure it's the right size. So in this manufacturer, there's actually an arrow that points to the accurate range marking. You see that white line? When you wrap this around your arm, that arrow should point within that white line. If it's outside of that, it shows you you should be either a medium, or if it's like this, you should be a smaller size. Okay, so most, you can check that when you go home, most have that range marking on them, especially the newer models. And then a valid monitor. Hypertension Canada puts out a whole list of blood pressure monitors, and there's a whole array of them. If you go online, you can get all kinds of different upper arm devices as well as wrist monitors and finger monitors. The thing is, you want to make sure that you pick a monitor that has been validated by Hypertension Canada and that is accurate for you. So you would bring it to your healthcare provider. They would take a measurement with their known accurate device and make sure that your monitor picks up. It should be within 10 millimeters of mercury of a known accurate device. Does that make sense? And then proper technique. So this is just a quick slide that shows you the impact of different activities that how they impact your blood pressure. So for example, legs being crossed can raise your systolic blood pressure by 6 to 10 millimeters of mercury. Okay, if you're lying flat, your back not supported, using a cuff that's the wrong size, they all have impact. So you can see, in order to improve your cardiovascular outcomes, so your risk of heart failure or kidney failure, all we need to do is lower your blood pressure by 2 millimeters of mercury. But if you've got your legs crossed and using the wrong size cuff, we're not getting an accurate measurement. You're not getting an accurate measurement at home. So it's really important that you follow the directions on how to measure blood pressure properly. And I brought a handout here if you're interested. It goes through all the fine details. So again, the devices are available at most pharmacies. I actually recommend, I should have Costco shares because I recommend to buy it at Costco. The reason being, it's a good device there. It's validated by Hypertension Canada, and you can return anything to Costco up to a year. Most of the devices say limited lifetime warranty, and the limitation is the cuff is only guaranteed for a year. So what you do is you purchase it there, keep your bill in your box, put it up in a cupboard somewhere. Next time you see your family doctor or nurse practitioner, bring it, have it validated. If there's any problem with it, you can just take it right back to Costco and they'll refund your money or give you a new one. So that's why I like Costco, because you won't find that at most pharmacies. They might give you 2 weeks or a month. I found Walmart, one Walmart was 2 months, another one was 3 months, but certainly not a year. Again, that's the logo. It will be on the box when you're purchasing it to show you that it's approved by Hypertension Canada, and make sure you get that right size cuff. So because of the variability of blood pressure, it's really important that when you take your blood pressure, you do it the same way all the time. You're comfortable in a quiet room, Do it on a bare arm. It's much easier to place the cuff and make sure you have it in the right position. And then you rest like that for 5 minutes. I had an investment advisor a couple of weeks ago and asked him how he did his blood pressure. He goes, "Oh, I sit at my desk, feet flat on the floor, back support." He went through the whole thing, and I said, "Now, are you just resting?" He goes, "No, I'm working on my computer." Well, that sort of takes away from that resting component. And I said, if you just make, 100,000 for a client, your blood pressure is going to change. If you lose 100,000 for a client, your blood pressure is also going to change. So it's really important that you take away as many of those factors as possible and just rest quietly, and no distractions. So you can see the impact of just routine things on your blood pressure. So this is the reason, because of that variability of blood pressure, it's important to do it the same way all the time. And so you rest that 5 minutes, take a first reading, then you wait 1 minute and take a second reading. So never just take one reading. You only have to wait 5 minutes, not 10 or 15. So 5 minutes, take the first reading, wait 1 minute and take a second reading. The reason being is that variability of blood pressure, and those two readings should actually be within 10 millimeters of mercury, meaning if the first one's 180 on 100 and the second one's 176 on 94, that's within 10. You've got good resting blood pressures, you would average those two numbers and you're done. If the first reading's 180 on 100 and the second reading's 162 on 89, that's way too big of a difference. There are studies that show that just the squeezing of the cuff on your arm initially pops most people's blood pressure up. So then you rest the 1 minute, and it allows the blood flow to normalize within the vessel. And then you take a second reading. It's more than 10 different, so wait 1 more minute and do a third. And typically the second and third readings are more accurate. And if you feel your pulse and it's at all irregular, you should do at least 2, if not 3 readings to make sure that that monitor is picking up properly, because it's dependent on what's going on at the level of your heart. So you do it in the morning before your medications, and in the evening 2 hours after a big meal. And you do it for a period of 5 to 7 days to sort of get an idea of what the overall picture of your blood pressure is. That way, we're not making treatment decisions on just one here, one there. It shows a pattern. You keep a record. I suggest getting a little book from the dollar store. You write down the date, the time, and your readings. And you can also put little comments in there that you forgot to take your pills, or that you were dizzy or lightheaded. All that information helps in managing your blood pressure. And that monitor you should bring to your family doctor once a year. Just make sure it's still working. And the reason this is so important is because we know now as healthcare providers that it doesn't really matter. We take good blood pressures in the hypertension clinic. We think we do a really good job. But the thing is, if you came to see us, you see us for a very brief period of time. So we get a little snapshot of what your blood pressure is when you're seeing a doctor and nurse. But we don't know what your blood pressure is in your own environment. And so that's why, if you have the right size cuff, a good monitor, and are using good technique, we know now that you can actually come in with that, or you can call me and say, "Jan, these are my blood pressure numbers," and we can make treatment decisions on those numbers, because home blood pressures are the numbers being taken where you are, where you live, during your regular day. And so those are the numbers that are important. Are you talking about mass? Yeah. Okay. So any quick questions about that? No?
Sorry, one question.
Yeah.
How is the resting blood pressure relevant when most of the time we're
So
not
that's
at
a
rest?
really good question. So the reason we ask for resting blood pressures at home is it's because it's halfway between that busyness of your day and sound asleep. So because of the variability of blood pressure, if we try to treat those blood pressures where you're, going into a meeting and then you're sitting at your desk, those numbers are so variable that not just Hypertension Canada, but European, British, everybody agrees that that resting blood pressure is what we want to make treatment decisions on, because it takes away the variability, and we know your blood pressure should go down at night as your body's recovering from the activities of the day. So this is the seated resting is kind of the midpoint of that. Make sense?
I have a question. Does it matter which arm you take the blood
So
pressure?
it does matter. Some people are significantly different in one arm to another. So when you're going to the doctor, your blood pressure should be measured in both arms initially to determine whether your blood pressure is equal in both arms. It should be within 10. If it's getting 15, 20, 30 millimeters of mercury different, then your blood pressure should be measured in the arm with the highest reading because it's more reflective of your central aortic pressure, what's going on at the level of your heart. Yeah?
So most monitors have this pulse also, pulse
Yes,
rate.
yes.
How is it useful in terms of blood pressure?
So it's good to, it shows you, and that's where a regular pulse comes in as well. So it's good to keep track of your pulse because often you're on a medication that affects the heart rate. And if your blood pressure or your heart rate is variable, if you're seeing a number of 55 and then you see 96 and then you see 76, that gives you a little indicator that perhaps your pulse is irregular. If that's a change, that's something you would want to report to your family doctor. That number should be fairly consistent, just like when you rest, your blood pressure numbers should be fairly consistent. That make sense?
One last question.
Sure.
Like you mentioned Costco. Costco has this cuff which is kind of hard.
Okay, so.
And then you have some flexible ones.
Right, so this is the cuff that was sold up until last year at Costco, and they came up with this design because it's called a multi-fit cuff. So you place your thumb here, and then you put it on your arm, you bring it up, I say a bare arm, so there's my bare arm, and you want that blue line and the tubing to go down your arm so that this is over that strong pulse there, okay? And then you hold it like this and wrap it around like that, okay? You want it snug so you can get 1 to 2 fingers under the edge of the cuff. You don't want to have it so loose that you can get your whole hand under here, okay? And so you have it lined up, and then you're in your proper position. So this was the old cuff, but people found when they put them on and they tried to tighten it, it twisted. So Costco now has gone to a cuff that's looks more like this. It's a soft cuff, so same deal. You have the tubing over the same position. Now this is way too big for my arm, but same deal. And people find this one doesn't slide as much. And so that's how you would wrap that one. So Costco has gone to this one now.
They have different sizes, like this is quite wide.
Yeah, so you check on the side of the box, there's range markings, and you want to make sure that you pick the range that's right for you. And how you would measure your arm is you measure from the bone here at your elbow to the bone at your shoulder, and then you say that's 15 inches. You take the midpoint of that, so 7.5 inches, and wrap it around here, so that's your arm circumference. So say it's 32 centimeters, you look on the side of the box and you pick the cuff for your arm. And there's a range, so, the manufacturers also, you can go online and you can order the appropriate size cuff for you, or your pharmacist will help with that. They're very good with that as well. Okay?